Judy Maggio here. Decibel has been checking in with various community leaders about the impact of this pandemic. So joining us today is Mike Geeslin. He is the CEO of Central Health. And this is the network of providers here in Central Texas that offers quality health care to people who don't have insurance or are underinsured. So Mike, thanks so much for being with us today.
Thank you for having me.
Let's begin with the big picture. You know, Texas has more uninsured people than any other state in the nation. So obviously there are going to be a lot of people out here who are worried about symptoms and don't have insurance, don't have a primary care doctor. So what would be your advice to them?
Well, first, I think it's important to note that just because you're uninsured does not mean that you don't have access to care, especially during a pandemic crisis like this. Central Health is the healthcare district for Travis County, and our mission is to provide healthcare to those that need it the most. And we do this through a number of different partners. Our largest primary care partner is Community Care Health Centers. We partner with Lone Star Circle of Care, with People's Community Care, and the two major hospital systems here in town, HCA St. David's, as well as our partner Ascension Seton. So there is a vast care network that we've built and assembled for individuals that do find themselves uninsured and that are living at or below 200% of the federal poverty level and need enrollment in a healthcare program, not only to take care of their hospital needs, but also their primary care needs.
So if someone falls into that category, what services are provided if they're worried about coronavirus? Is there a way for them to reach out to you? Should they go to one of these community care clinics or People's Community Clinic? What would be like the first step they should take?
Well, if they are symptomatic and they feel that they may have been exposed to the coronavirus, we would ask that first they call one of the hotline numbers. And there's one in particular that I'd like to point out, and it's 512-978-8775. And so if you're having symptoms and you're currently uninsured or don't have a medical home, please call that hotline, and the individuals that are staffing that hotline will assist you with triaging and getting lined up for testing if your symptoms indicate that you do need to be tested. But I think it's important to note that not everybody is going to be tested. So that's why we're having to use through our clinical partners guidelines to determine who all needs to be tested.
So what would be some of the symptoms that somebody would need to reach out about? What are some of the symptoms to look for?
Well, first I need to give the disclaimer that I'm not a medical doctor, and so I'm not providing any medical advice, but COVID-19 is a respiratory infection, and some of the materials and information that we've been putting out, we note that there's coughing and sneezing, fever, and so there's a variety of symptoms related to respiratory viral infections that people would experience. Some people may feel like it's a mild case of the flu or a really bad cold, but that's the sort of symptoms that people need to be paying attention to.
So it sounds like if somebody is feeling some of those types of symptoms and fever, and we've seen a lot of those warning signs, they should call the hotline number. Let's talk also about the care providers in your network. I know there are a lot of clinics and they're fully staffed, a lot of them. Is there a concern that we're hearing from the hospitals? It's the same concern as your providers about a shortage of masks and protective gear and ventilators and those types of things. What have your providers told you?
Well, first of all, we have a national shortage, and Texas and Travis County are no exception to that. And yes, we are hearing about shortages of personal protective equipment or PPE. And, I really want to commend not only clinical leaders, but hospital leaders for stepping up and really working to conserve that PPE and make sure that they're taking steps so that their providers can be protected. But more important, that the people that they're serving or caring for are also protected as well.
So once again, we want to let everyone know that just because you don't have insurance doesn't mean you can't get quality treatment for coronavirus. Anything else that you want to make sure the public knows, especially the people who are in that low income category? A lot of these people feel like they can't stop working as well. So they're in the professions that don't necessarily provide them with a healthcare plan. Any other message you want to get out to those folks?
Well, these are very challenging times, and it's, we've, as a society, we here in Travis County, we haven't lived through anything like this.
Right.
But I think it's important to know that Central Health, we fund healthcare for 1 in every 7 people. In our medical access program, we have over 24,000 enrollees. In our medical access basic program, medical access program basic, which is a sliding fee scale program, we have over 35,000 enrollees. And we're able to serve and pay for the healthcare for a lot of people. And as a result, we've built a vast network of providers that can provide care not only for COVID, but if you have chronic conditions that need to be managed, we can provide care for that as well. And this type of safety net, it wasn't just assembled yesterday. This is something that we've been building on since our inception. And yes, we're going to test it, and we ask for people's patience, and we may have to take measures to conserve various protective equipment supplies. But our goal is to provide health care to those that need it most, and that's what our mission focus will be.
Mike, there's a lot of mixed messages and a lot of just information coming at us. What about people who may be worried about, getting out and going to a clinic if they have a medical issue? Perhaps it's not COVID-19.
Right. Well, we are fortunate to partner with Community Care Health Centers, and that is a federally qualified health center and one of the largest in Texas. They are quickly moving to a telehealth model. And you've heard the phrase telehealth or telemedicine or remote medicine. But the idea being is that providers and patients can talk on a phone or over a computer connection, just like we're doing now, and be able to receive care. And it's not only certain diagnostics that the provider, testing that the provider might perform to see if a patient needs to be tested, or helping to manage their conditions that they had pre-COVID, but also filling prescriptions as well. And so there is a way to seek care without necessarily having to come into a clinic. And we'll provide that phone number, but if you are scheduling an appointment with Community Care, you can call 512-978-9015, and they will walk you through the steps to be able to use their telehealth or their telemedicine options. Another important point is pharmacy. A lot of people, it's not just about daily interaction with a medical provider, it's about maintaining their medications. And so again, Community Care, we're thankful to partner with them, but they are providing means to do curbside delivery at one of our clinics. It's the Southeast Health and Wellness Center. And they also have other pharmacy partners that can ensure that people have a 60 or 90-day supply of medications as we go through this response period.
Well, I know there are a lot of vulnerable people in our community that will be depending on you and the large vast network that you said is the safety network that is under the umbrella of Central Health. Mike Geeslin, thank you so much for sharing your perspective, and thank you to all of the providers who are working right now to take care of our community during this difficult time. Thanks again.
Thank you.